Hi, I'm Bridget, and I'm here to talk to you about medical coding. You're probably here for one of two reasons. Either you're interested in a career in medical coding, or you've run across medical coding in your job as a lawyer, accountant, or journalist, and would like to know enough to get your job done. Either way, you're in the right place. First, what is medical coding? Coding is the language that doctors use to speak to payers like Medicare, Medicaid, TRICARE, and private insurers. Doctors speak the language of medicine. Payers speak in medical code. Doctors have to be able to explain what they've done to payers in order to get paid. That's where the medical coder comes in. The coder translates the doctor's notes into a series of codes that the insurance company can understand. Let's talk a little bit about how this is done. First, it's important to know there are different coding systems for different types of medical providers. Hospitals, physician practices, nursing homes, and home care agencies all speak different languages. Today we're going to focus on physician coding because it comprises the largest part of the coding world. Even within physician coding, there are different kinds of codes. The two biggest are ICD-9 and CPT. The ICD-9 codes are called diagnosis codes. They explain what was wrong with the patient. There are codes for fractures, headaches, infections, sore throats, and just about anything you can think of. There are more than 9,000 diagnosis codes. The CPT codes explain what the doctor did to fix the problem. Did he do an exam? Did she put on a splint? Did he suture the lesion? There are more than 15,000 of these codes. Let's look at an example. Imagine that you see this in the very worst of doctor's scrawl. PT, finger pain, contusions to upper arm / SHLDR, glass embedded RT, INDX, FNGR, incision to remove glass with SPLNTR, FRCPS, STERI. Our coder knows that this means a patient showed up at the office today complaining of arm and finger pain with contusions to her upper arm and shoulder and a glass splinter embedded beneath the skin on the right index finger. After taking an expanded problem-focused exam and an expanded problem-focused history, the physician made one incision over the foreign body site, permitting her to remove the glass with splinter forceps. The area was then cleaned and secured with steri strips. The coder can translate this into a series of codes. 10120, 99282, -25, 923.09. This might not mean a lot to you and me, but here's what it means to our insurance company. The coder reported CPT 10120 to show that there was an incision and removal of foreign body of subcutaneous tissues that was simple for the foreign body removal. Then she reported CPT 99282, emergency department visit for the evaluation and management of a patient, which requires these three key components: an expanded problem-focused history, an expanded problem-focused examination, and medical decision-making of low complexity for the E&M service. Then she attached modifier 25 to show that there was a significant separately identifiable evaluation and management service by the same physician on the same day of the procedure or other service, to 99282 to show that it was a separate service from the foreign body removal. Finally, she linked ICD-9 code 923.09, contusion of upper limb, multiple sites, and 915.6, superficial injury of finger, superficial foreign body, splinter without major open wound and without mention of infection, to 10120 and 99282 to prove that the whole encounter was medically necessary. I know it sounds very confusing now, but trust me, with a little training it will all make sense. So about that training, I've included some links to resources here. If you're interested in learning about medical coding, but not in becoming a certified medical coder, check out this first link. It will lead you to a Coding for Non-Coders 1-hour course. If you are interested in becoming a certified medical coder, congratulations! You've chosen a great profession. If you're smart, organized, and detail-oriented, this could be the profession for you. Check out the second link. It will lead you to some courses that can help you train for certification through the American Academy of Professional Coders. If you're just looking for more free coding information, check out this third link. And if you have any questions, feel free to contact me at seminars@medville.com. Just tell them you saw Bridget's YouTube presentation. Good luck!